All right, hey everybody, Dr. Scott. So I'm just gonna cover kind of rehab, physical rehab, kind of part two. So a couple weeks ago, we covered some things that you can do for your thoracic spine, some chest openers, some stretching for your chest, really to just keep your spine healthy. And a lot of us get in this forward, posture, and that's no bueno on anything. I did cover a little bit about the pelvis and kind of the hip flexors. Just to refresh your memory, we talked about the pelvis kind of being like a bucket. You don't want the bucket to be tipped forward or backwards. That's not as common for people to have that kind of posterior backwards tilt, but it does happen. So you can kind of evaluate yourself. We want the bucket to be neutral, right? And so part of that is the front side of the hips. When the hip flexors are tight, the quads are tight, maybe from sitting all day, they're short. You don't get up and stretch enough. We kind of pull that forward. That's going to put a tremendous amount of stress on that lower lumbar spine. So how many of us have had, lumbar spine, low back issues, SI joints, which are the two big joints, the bones that you feel there? That's a very, very common place people will visit physical therapists and chiropractors for. I've seen it a million times in my career and help people with that. And oftentimes, you can address the joints, but a lot of times it's the soft tissues such as the hip flexors that are contributing to or causing that from that pelvic position. So we went over a lot of things, and some of the cervical spine stuff we went over. I want you guys to hopefully you practice some of that, and I want to add to that today. So, these types of recommendations or tips and strategies really are for you to use and kind of self-analyze. I mean, if you do the hip flexor stretch and you do it. Sorry, I have kids over here making noise that aren't supposed to be making noise. Apologize for that. If you try something and you're not really sensing that it's an issue for you, like you're not feeling a lot of tension in your front of your hip flexors, well, that's fine. Then you probably don't have to focus on that one. So it's kind of a trial and error type of a thing with some of this rehab. So today I want to cover a little bit more, just with the hips and kind of the soft tissues around there, because the pelvic position and this stuff is just so darn common, and just not a lot of people are being proactive enough, and then they end up with something, like low back issues, disc issues, sciatica, all of these types of things. So just like we've talked about with other stressors, emotional stress, chemical stress, physical stress is often, it is a cumulative thing as well. So if you're like, well, I don't have hip pain, I don't have low back pain, I don't have sciatica, I never have, right? We don't want you to. I don't want you to. And so a lot of times we have these issues going on, these dysregulations, and we don't even know it. And then one day we wake up and boom, we have this low back pain, or boom, we have this sciatic nerve stuff going on. The same thing is true in the upper body. I want to show you guys a couple really cool things that I've used clinically for 15 years with patients with things like carpal tunnel. Now, carpal tunnel, I'm going to say is like, it's a very specific diagnosis. The tunnel in front of the carpal bones is where the nerve can get hung up that feeds these three fingers in most people. So you wake up with numbness and tingling in these three fingers. Now, 50% of carpal tunnel surgeries fail and actually can potentially be worse. Why is that? Why is that statistic so drastic? Because a lot of times that nerve is not actually entrapped only in the carpal tunnel. It can be entrapped and have pressure in the forearm, in the elbow, and even up higher from the origin in the neck. And so there's some really cool little stretching type techniques that I'm going to show you today to help mobilize the nerves that feed your hand. Now, the carpal tunnel nerve is called the median nerve. That's only one of three nerves that feed your hand and your fingers. So I'm probably not going to go over all of those. I'm going to go over the median nerve today just because I don't want to overwhelm you. If you guys have problems with numbness and tingling, say in just these two fingers, the pinky and the ring, that's a different nerve, okay, called the ulnar nerve, kind of your funny bone nerve. So there's a different stretch for that. The radial nerve is kind of more so that runs the back side of the forearm to the back of the hand. Not as common to see that, but it does happen. So if you have issues with that, get a hold of me and I can definitely make a video and send that to you specifically. So let's get started here. I want to show you guys to start kind of the hip and the pelvis kind of flow that I really like. So I'll do this myself. If I'm warming up for a workout and I need to open up my hips, or maybe through the day I'll hit a couple of these if I'm sitting a lot. I really, and hear this, if you guys like to exercise and work out, lift weights, do HIIT training, high intensity interval training, anything like that, which I like to do, boot camps and CrossFit workouts, really a great time to stretch is after you're done working out. You got a lot of blood flow going, your muscles are loose, right? You probably started out a little stiff, so you need to warm up for a workout, right? But then afterwards is really a great time to stretch, to get length in these tight muscles that have tightened up all day. So pre-workout, my favorite thing to do is more of a dynamic warm-up. So it might include a little stretching, but it's more so things to get the body moving, get the blood flowing. So get a little bit of a sweat going is what I like to do. And then I might do a little mobility, flexibility work, a little bit of stretching if I know something's tight. And then I go into my workout and then I try to spend 5 or 10 minutes after I'm done doing things more like this, okay? So just like we covered in the last video, part 1, you can stand if you can't kneel on your knee, for example. You could put a pillow or a foam pad. I have these really nice 2-3 inch thick foam pads that if I'm in my garage working out or on a hard floor, I'll put underneath my knees. Super cheap. You can find them on Amazon or probably at Walmart. I don't even know. But just something to protect your knee if you want to kneel. Because I really like the kneeling position. You don't have to worry about balancing as much, and you're just kind of non-weight bearing here for the most part. But you can stand up to do most of these, just so you know. Okay, so if I'm going to start, I'm going to again focus on my pelvis position. I don't want the bucket tipped forward. I do not want that hyper extension in my back, okay? Because you remember I talked about that hip flexor. I don't feel much of a stretch and I'm going all the way forward here, but if I tilt my pelvis to a neutral position by kind of just squeezing my butt down a little bit, I go already right there, I feel that stretch. So that's my first stretch I like to do, and I'll kind of show you from the side here. Get in the right position, stretch forward, hold it for just a second or two, and then back out of it. And I'll just do some nice slow repetitions. I also want to watch this knee. I don't want my foot to be so far back that my knee's going out like this. That's a lot of strain on your knee as well. So make sure you step out far enough to where the end point of this stretch, your knee is not really that far, if at all, past your toes, okay? So here, what I'll sometimes do is I'll combine. So I like efficiency. We don't have a lot of time in the day. I know I don't even like to stretch, but I know it's necessary. So what I'll do is I'll go here, and then I'll rock it back into a nice hamstring stretch, okay? So again, here, and then I'll rock it back. I might slide my foot forward a little bit, and all I'm doing is kind of sitting my hips down towards the floor, feeling that nice pull in my hamstring. If you need to support yourself on something, that's fine too. So I can hold this fireplace over here, and in and boom. So I might do this, 8, 10, 12 times, just anything that's going to get that nice and loosened up. I really like that little flow, that combination. Okay, the next thing I'm going to do, which this is a muscle group that is just forgotten about, and people just don't even know about it. They don't know to stretch it. They don't know how tight it can actually get. And that's the adductor. The adductor muscle group right on the inside of the thigh attaches to your pelvis, comes down to your knee. Some of them attach here, some of them actually cross the knee. So let's work on that. So again, from this kneeling position, I might just take this leg out as far as I can go, okay? And I'm gonna actually hold with my hand like this, and then I'm just gonna take my body this direction. Kind of the same rule apply. Watch this knee. I'm getting a little bit too far out, so I'm gonna slide my foot out a little bit. I'm gonna press backwards with this hand just lightly. I already feel a stretch there, so I know I have some tightness there. And then I'm gonna lean that way. Now be careful with this one. Number one, I feel a lot of stretch here, but I also feel a stretch on the other side, kind of in my groin area. So again, here, Sometimes I'll even add a little pressure with my hand on the outside here, and I really feel that on both sides. So again, efficiency, I'm hitting 2 birds with 1 stone with this one stretch. I'm getting the adductor group over here, and I'm kind of stretching some of the groin stuff over here in the hips. Now, if you have hip problems, if you have hip pain, if you have hip osteoarthritis, these can be really great for you, but you just got to go really slow. And you just have to just take your time, okay? If you're in a standing position, it's a little harder. You can't necessarily do that exact same thing. But if I was standing, and say I'm holding a chair or a countertop, okay, I'm gonna basically put my leg out like this, and then I'm just gonna sit back and down like this. So again, I can support myself. So again, I feel that pulling through there. So from the side, what I don't want is just this. I want to sit back and this way. You guys see that? I'm kind of a little bit more of a squat than just a straight sideways lunge. Okay, so from here, we're going here, in and out, again, 8, 10, or 12 repetitions. So now we've hit the front side with the hip flexor. We've hit the inside adductor group. We hit the hamstrings, the back side. Now we want to hit the glute a little bit. So if you have that low back pain, that sciatica, the glute area can be a big problem, specifically a muscle called the piriformis. So this stretch, you've probably all seen this. It's called a pigeon stretch in yoga, pigeon pose, whatever. I'll do it from the front first. But essentially, I'm going to take one of my feet up, kind of kneel down, slide it like this. My other leg is just straight behind me, and I'm just going to sit back as far as I can comfortably, okay? So I'm just gonna sit back, and then what I like to do is kind of push the side I'm stretching, I'm gonna push towards the ground this way, and kind of almost even lean into it like that. And then I'm gonna do repetitions. So sink in. That feels really, really good to loosen up the back of the hip. Now, if you're someone who's really flexible, you can like sit on the ground and you don't even feel a stretch, well, then you probably don't need this one, right? So again, these are just ideas for you. Hey, Stetson, buddy, can you get off the table? Thanks. My kids are watching me. I have an audience right now. They're actually trying some of the stretches, which is cool. So from the side, here's what it's gonna look like. Here, and then shift and down. Okay, so that's a really, really great simple way to kind of start opening up. Now there's some more detailed, there's some more complex things that you can do if any of these areas are really problematic for you. I'm not going to go into all the nitty-gritty details so say that sciatic area is an issue for you, and that you do this stretch and you're like, oh my gosh, like that's really tight. There's gonna be some things down the road that you're gonna wanna do in addition to that simple stretch, but that's a really, really good start, okay? So once that starts loosening up and you do this, you could do these stretches a few times a day. I'd recommend it if you have an issue. I mean, the more you can do, the better, just like everything. Interrupt the vicious cycle of all this tightness and contraction and issue, okay? All right, so lower body, right? If you just kind of go through that flow, watch that flow a little bit. Let me put it all together for you. So if you want to re-watch. So tip the bucket to a neutral position, forward. I'm going to do some repetitions like that. Hamstring, hip flexor, hamstring. So 8, 10, 12 reps. Throw this out to the side, press back a little bit here. And just go as far as you need to. Kind of, maybe you can play around with that, okay? That's a great one for both hips, okay? And then I'm gonna sink right down into that pigeon. Okay, so that should just take you a few minutes to do. Do it on each side, obviously. All right, so now let's change gears. So, nerve issues, okay? So, numbness, tingling in your arm, mostly in your hands and fingers. You could easily look up YouTube videos, Google nerve sliding techniques, or that there's probably multiple names for it, but that's just what I call it, nerve sliding or nerve gliding techniques. So really, here's what I want you to kind of picture in your mind. If you have a rubber band and you stretch it, right, think about that being a nerve. Do you think stretching a nerve from both ends is a good thing? No, that's going to put a lot of tension on the nerve. It's going to cause zingers. It's going to cause more numbness and tingling. Same thing happens as if you squish a nerve. If you put a lot of pressure on a nerve, like say you hit your funny bone, boom, there's the nervy stuff. You sit on your toilet seat too long and you get up and you have a numb leg because that pressure was right on that sciatic nerve. So you guys kind of get the point. The same thing can happen in multiple places down your arm, starting from your neck to your hand. And that's what carpal tunnel is. It's pressure on that median nerve in the carpal tunnel. So one thing we want to do with the nerve is not stretch it. We want to glide it like this. Okay, so we want to make sure it's lax on one end as we stretch the other end, and it's going to pull it that way. And then we do the opposite. We pull this way and slack this side. So think about like if you put a spaghetti noodle through a straw and you held it and you just want to go back and forth. That's kind of what we want to do with the nerves. So this specific nerve called the median nerve comes out and has multiple nerve roots from your cervical spine. We don't need to go into that detail, but they basically all come down and meet down underneath your collarbone, and then they go together here, and then they start branching, okay? And the median nerve comes right down through the front of the forearm to the hand to these three fingers in most people, right? So how do we relax the nerve on one side and stretch it on another? Well, if we think about the fulcrum point, say, being like right in this shoulder area, I'm going to stretch those nerves by taking my head away, and I might feel quite a pull here, which I do, okay? And then I'm going to relax the nerve on this side by doing this. I'm just going to, don't make it too complicated. Just keep your arm at rest like this. So this is the starting position. Then what you're going to do is stretch it the opposite way. So I'm going to start stretching it by taking my shoulder back, elbow extended, wrist extended, fingers extended here. Now if I end in this position, I'm stretching it like a rubber band, and I can tell you when I just did that, I have a lot of tension. I can feel that stretch all the way down that nerve pathway to my hand and fingers. And I start to feel a little bit of tingling and numbness in my fingers if I hold that too long, because I'm stretching that nerve, okay? So we don't want to do that. So through this, start here, open the shoulder. So you guys see what I'm doing there. Kind of take the shoulder back. That's the step most people miss. Shoulder back, elbow back, wrist back, fingers, hand. So this is the end position for the arm. At some point during that movement, when I start feeling some tension building or maybe tingling building, that's your cue to tip your head towards that side. And then you finish the maneuver. Now a lot of that tension is gone. So I'm gliding that nerve through all these soft tissue pathways. So to put it all together, start position, shoulder back, elbow, wrist. I start to feel it, so I'm going to go here and here. Come back. And once you get coordinated with that, I can do 20 repetitions of that in, let's say 45 seconds to a minute. You don't want to speed through it, but you don't need to take a ton of time to do it. And there's researched evidence that shows these nerve gliding or nerve conduction techniques have been shown to be as effective or more effective than surgery for things like carpal tunnel. Okay, so this stuff can be powerful stuff if you have these kind of issues or know somebody who does. What the research showed was 20 repetitions 3 to 4 times per day. So if you interrupt that cycle and do this 3 to 4 times a day, especially if you work out in front of you and you type a lot or you write a lot, you use your hands a lot, turn wrenches a lot, whatever you're doing, if you have a lot of that forearm, hand, repetitive motion, cumulative kind of stress on those areas, then you really need to interrupt the cycle. You can do it 5 or 6 times a day, honestly, and it does not take that long. So I hope this was informational for you guys. Again, it's just kind of like scratching the surface on some physical stress relief that if you go to a chiropractor who knows what they're doing, if you go to a physical therapist who knows what they're doing, these are the types of things that they would be showing you and having you do. So, save a few bucks, and instead of maybe having to see someone, start to be proactive. Take some action steps. Start treating your body like you only have one of them, right? And a lot of times I have to look in the mirror and I'm talking to myself because I can get busy and I can work out, but I can also forget to stretch or not take the time to stretch and do these things. And then it can accumulate. And then I'm sorry for it, I pay for it later on. So I'd really encourage you guys all to watch this video maybe once, maybe twice, or just fast forward to the parts where I'm going through those flows and watch the video as you do these things to make sure you're checking your form, checking your technique. It's so often about quality of movement and not quantity. We want a certain amount of quantity, you know, that 8, 10, 12 reps, 20 reps of the nerve stuff, but it's so much more about the quality, making sure you're doing things well. So I hope you guys got something out of that. Hit me up with any questions if you have them. And again, if you need some deeper level stuff, you know, on my YouTube channel where you guys have this link, I mean, you can go back in history and I have hundreds of videos from past things that I've done in the rehab world and physical stress world. So, okay. All right, y'all. Have a great rest of your week. Hope you enjoy. Bye-bye.